here today. A lot of staff expressing great joy and delight and relief at having got their vaccinations, and staff expressing frustration and upset that they haven't yet got their vaccinations. And the reality is, I think we have some of our staff working side by side, some who are vaccinated right now, some who are not, which I presume is a function of the supply. When will that issue be resolved satisfactorily, do we think?
Yeah.
Well, first of all, we want to get to all our frontline staff, be they hospital or community, as quickly as possible. The only rate limiting step for us is securing the vaccine deliveries currently with Pfizer and then Moderna. And the secure deliveries we have, like other European countries, is limited for the foreseeable next few weeks. In line with NIAC, for those of you who aren't familiar with NIAC, the National Immunisation Advisory Committee, they laid out a series of priorities, and the priorities were based on where the vaccine would have maximum effect. We know the vaccine from evidence reduces the chance of serious illness among those people who contract the virus. And for that reason, NIAC, and it is an agile document because we'll be learning as we go along, have prioritised number one, older residents of long-term care facilities and healthcare workers there, and number two, what are called frontline healthcare workers. And we've issued clear guidance, working with Martin Cormack and his team, as to the different categories of workers and how they would be categorised in terms of prioritisation. In other words, people who work with patients in COVID wards or in COVID settings or in what we could call uncontrolled settings would clearly have priority. Now, of course, there will be some unevenness because when we were starting the programme, we started in 4 hospitals. Then we trialled out in a hospital group over bank holiday weekend. And then we went through all our hospital groups. And then in parallel with that, we asked the hospital groups to reach out to the community, to community healthcare workers. What we want now is, once we finish this exercise in residential care settings, that once we get those secured stocks in February, in early February, to focus again using our framework of prioritisation as to who constitutes what priority, no matter where they work, to target those priority healthcare workers, either using our hospital facilities to administer the vaccine or using other facilities. So we will get there.
How will individual staff know they're going to be vaccinated, whether they're hospital staff, community healthcare workers or whatever? How will they know that that's...
Well, we're working closely with Anne and David Walsh and Yvonne and other people, and in the hospital sector, Liam Woods, to identify obviously the staff who already received the vaccine, and also to identify where each staff fit in the prioritisation schedule. So we can then give them some idea of what category they lie in. But the ultimate scheduling will depend on when we get secured delivery of doses in February, and then we can resume the priority healthcare workers.
Okay, and staff who may be reluctant to receive vaccines. I read somewhere recently that is a very, very low number, but if there are staff reluctant to receive vaccines, what do we say about them and to them?
Well, there's no compulsion. As we know, during many annual flu vaccine programs, we've greatly encouraged staff to get flu vaccines, not just to protect themselves, but protect the people who they care for and their services. And we've seen huge improvements in the flu vaccine program over the years, from a baseline of 25% some years ago to now, I think it's 60%. But there's variation there. Some places do better than others, some hospitals do better than others, and so on. So there's no compulsion on people to get the vaccine. But based on the uptake we're seeing, the enthusiasm, the energy, the volunteerism to help out administering the vaccine, we see very few cases of people refusing to get the vaccine. And I think that's because people recognise what the vaccine does. They feel assured by the evidence to date. And they see how it might allow them not just to protect themselves, but protect their patients, and also protect the services they work in.
I saw the phrase queue jumping coming up on the chat there, which is something which is talked about an awful lot. What do you do to safeguard the priorities? You know, vaccinations are being administered in a lot of different locations, in a lot of different parts of the country. What can you do? What can individual staff do? Maybe Paul.